Everyone, welcome back to my video. If you're an RPN in Ontario, a BScN student, or you're thinking about bridging from RPN to RN, this video is for you. One of the most common questions I hear is, how does the role actually change at work, especially with technology? Because Ontario healthcare is heavily technology-driven now, electronic documentation, monitoring systems, medication technology, everything. So today I'm breaking down how the RPN role transitions into the RN role from a CNO scope of practice perspective, with a focus on how technology is used differently. Section 1, CNO Big Picture. Let's start with the CNO Foundation, because this matters. According to the College of Nurses of Ontario, both RPNs and RNs are self-regulated professionals, but the difference lies in depth and breadth of knowledge, clinical judgment, level of autonomy, complexity and predictability of client care. So when you move from RPN to RN, you're not suddenly learning brand new technology. You're usually using the same systems, but your accountability for clinical decision-making increases, especially in less predictable and more complex situations. Technology supports that expanded scope. It doesn't replace it. Section 2, Electronic Documentation and Assessment. Let's talk about electronic health records because documentation is a big part of nursing accountability. As an RPN, you document assessments and interventions for clients with stable or predictable outcomes within your scope and employer policies. As an RN, your documentation reflects comprehensive assessments, ongoing reassessment of complex or changing conditions, development and evaluation of nursing care plans, interpretation of lab values, diagnostics, and clinical trends. From a CNO lens, this documentation demonstrates independent clinical judgment and accountability for care decisions. So the shift is from documenting care provided to documenting clinical reasoning and decision-making. Same charting system, greater depth of accountability. Section 3, Monitoring and Clinical Decision Support. Now let's look at monitoring technology. In Ontario workplaces, RNs are more often responsible for clients with unpredictable outcomes, rapidly changing conditions, higher risk of deterioration. This means using technology like continuous monitoring systems, early warning scores, clinical alerts. From a CNO perspective, the RN is accountable for interpreting data, identifying subtle changes, determining when to intervene or escalate care. Technology provides information, but the RN applies clinical judgment to determine next steps. Section 4, Medication Technology and Accountability. Medication administration is another area where scope and accountability expand. In Ontario, RPNs administer medications within their scope for clients with stable and predictable responses. As an RN, you're more likely responsible for IV medication administration and titration, high-risk medications, complex medication regimens, ongoing assessment of therapeutic and adverse effects. Medication technologies, like smart pumps and automated dispensing, support safety, but under CNO standards, the RN remains accountable for clinical decisions related to medication management. Section 5, Coordination, Delegation, and Communication Technology. Another key shift is how RNs use technology for care coordination. Ontario RNs often engage more with secure communication systems, escalation and rapid response tools, patient flow and discharge planning platforms. From a CNO standpoint, this reflects the RN's role in coordinating care, collaborating with the interprofessional team, delegating appropriately based on client needs and staff competence. Technology supports leadership within the care team, not just task completion. Section 6, Quality Improvement and Informatics. RNs in Ontario are also more involved in quality improvement and system-level initiatives. This may include reviewing outcome data, participating in quality improvement projects, using dashboards related to patient safety indicators. This aligns with the CNO expectation that RNs contribute to improving nursing practice and the healthcare system. For some nurses, this is the entry point into roles like informatics, education, or leadership. Conclusion. So here's the key takeaway, straight from a CNO lens. The RPN to RN transition is not about becoming more technical. It's about taking on greater accountability for clinical judgment, especially in complex and unpredictable situations, while using the same technology in deeper ways. If you're bridging or thinking about it, your RPN experience is a strong foundation. The RN role builds on it. It doesn't erase it. If this video helped, give it a like and comment. Thanks for watching.